Liquid rhinoplasty or non-surgical nose job, especially when we see 15 minutes nose job marketing everywhere. Sometimes this decision becomes a bit difficult for patient to take. So, are you a candidate for a liquid rhinoplasty or a non-surgical nose job or not? Let's discuss these points in this video. Liquid rhinoplasty, what it actually does. Fillers are used in liquid rhinoplasty which are hyaluronic acid based, and it can do some minor modifications and camouflage some asymmetries in the nose, and it can also add or reshape small parts of the nose. What all it can fix? It can fix mild asymmetry, slightly drooping nasal tip by adding some support. It can reduce slight dorsal hump by adding some volume and by camouflaging, and it can also help reduce the appearance of flat nasal bridge. What it cannot fix, it cannot improve a thick bulbous tip, a large hump, wide nasal bones, big nose, or nose which is having breathing difficulty as well. So these fillers usually last for 9 to 18 months and may last slightly longer in some cases. Then what problems, what risks are associated with these fillers when we do liquid rhinoplasty? It can lead to vascular occlusion, it can lead to skin necrosis. Also, in very rare scenario, it can lead to blindness because nose is an extremely vascular area. As compared to liquid rhinoplasty, what a surgical rhinoplasty does, it reshapes nasal bones, it reshapes nasal cartilage, it helps improve breathing, and also it helps reduce or increase the nasal structure to get the final aesthetic outcome. The results which we achieve after surgical rhinoplasty are long lasting, but the downside is it's a surgery. Again, risk of anesthesia and surgery is always there. Then there is a specific downtime over which the swelling reduces gradually. So liquid rhinoplasty adds volume, works by illusion, and makes nose look straighter but not smaller. Surgical rhinoplasty, on the other hand, removes or restructures the nasal shape permanently. The effect is permanent, and there are some things which as a patient you need to understand, that if you use fillers repeatedly in nose, it can lead to problems, issues whenever you plan to undergo rhinoplasty. Fillers lead to fibrosis, fillers can stretch skin, and fillers can definitely make the future surgery a bit more complicated. And also the substances used to dissolve fillers do not work so efficiently that they can take the nose to the virgin state. So in a nutshell, if you want some minor refinements in your nose, fillers might work. But if you want transformational and drastic changes which should last long, then surgical rhinoplasty is the best option for you. You should undergo liquid rhinoplasty only with those surgeons who are well trained to inject in the nose. Then they should be well versed with the nasal anatomy, they should be well versed with the vascular anatomy, and along with it, also they should have things available to manage complications if at all it occurs because of vascular occlusion while injecting a filler. So this is not a spa procedure, it needs to be conducted by a trained injector, a trained aesthetic and cosmetic surgeon. For more such informative videos, subscribe and follow us.